so many wonderful aspects to Obamacare. You will hear it referred to as Obamacare, Marketplace, and ACA. Everybody sort of has preferences, but it's all essentially the same animal. In terms of the legislative beauty of this, this new plan that Obama has created, there have been lots of blessings in the background that we wanted to highlight today so that people could understand the nature of the work that we're doing and all of the legislative benefits that have come about as a result of Affordable Care Act. So young adults can now be on their parents' plan through age 26, which is very exciting. Probably in the 70s and 80s when the economy was a little bit more stable, when children turned 18, they could usually find some type of employment and emancipate themselves and live independently. But we know now that the economy has changed and college and job search options for people have also changed as well. And so oftentimes young college students still do count on their parents quite a bit financially during those years. And so we're very excited that young adults can now access care through the age of 26. Free preventative care is provided and there are no lifetime limits on costs. Previously, in years back, the insurance companies had the capacity to set a cap on how much benefits people could use. They would usually say, you know, we've already spent $250,000 on your care or $500,000 or whatever it might be. And for a person that's very, very sickly and in need of lots of costly treatments, in the past the insurance company could simply just put a stop to their care because it had reached that cap or that limit. But now with Obamacare, there is no lifetime limit with the plans. Children with pre-existing conditions cannot be denied coverage. This is actually a huge groundbreaking element of Obamacare because children with special needs in the past would often get redlined by insurance companies or had difficulty accessing care and treatment that they needed in order to be healthy and safe. So now they cannot be denied coverage if they have a pre-existing condition. No higher premiums based on gender. This is one of my favorite aspects to the Affordable Care Act. In the past, in the very recent past, women's health, I think, was treated a little bit differently, and women would have to pay additional co-pays for birth control and preventative care services, and now it's actually rolled into the marketplace plans, which is a big blessing. I also enjoy this aspect of the plan. Costs must be plain and clear in language with understandable words. So their insurance companies are not allowed to send you 15 pages of 6-point font gobbledygook. Things have to be very clearly and simply stated in their plans. And we like this because the easier it is for clients to understand their plans, the more likely they are to be cooperative and get the care that they need. So these are some exciting aspects of Obamacare. Some of the preventative screenings that are included with any marketplace plan include a yearly physical, which is very a wonderful provision, blood pressure checks, cholesterol checks, and I particularly am fond of this one, cancer checks. So women can now get mammograms and pap smears as part of their plan, and also other preventative services like colonoscopies. So the emphasis is more on prevention, which is very exciting. Vaccines are covered, depression screens. This is huge because we all know that mental health plays a very vital role in the client's or the patient's ability to care for themselves. So if they're experiencing depression and their appetite is impacted, their mood is impacted, their energy level is impacted, it's going to affect the way they respond to their provider and respond to the care and treatment that they're getting. So depression screens, we're very happy about that. Well women visits, again, you heard my spiel about how I feel about that. And also breastfeeding support, which is very dynamic. We're pleased with this. And birth control. So now women have access to that as part of the plan. You might ask yourself what's included in a typical marketplace plan. And every single marketplace plan has to have some element of coverage in all of these spheres. They have to provide some prescription drug benefits. Each plan might have slight variations in terms of which medications they prefer or which medications are covered, but they have to have some plan outlined in advance. ER visits are covered. Maternity and newborn care has to be covered for any marketplace plan. Prevention and wellness, which I just discussed with you. Dental and vision. There could be variations in the way that each plan handles their vision and dental, and they do sometimes have a separate standalone plan that people can purchase. But in general, all marketplace plans do have to have some provision for dental and vision. Ambulatory care is covered. Pediatrics is also covered. I'm very excited that mental health and AODA are covered, because we often know that a person that's facing a substance abuse issue or contending with mental health issues, that impacts their whole health. It's not just, as we know with serving our clients, if clients do not present with one isolated issue, generally there's a multitude of issues that overlap. So we're happy that mental health and AODA are provided for. Lab work is supposed to be covered, and also hospital visits as well.